Okay, hi everyone. Thank you for joining us for this World AIDS Day event. My name is Arun and I'll be your MC for today. So the videos you just watched are actually part of an education program that the National HIV Program has worked with our partners to debunk the myths and how HIV can be transmitted. Incorrect information on HIV may lead to stigmatizing attitudes and discrimination towards people living with HIV. This is why it's important for all of us to know the facts and to prevent the spread of misinformation. Now, we will turn the time over to Deputy Director of National HIV Program, Dr. Wong Chen Seong, who will provide us with the welcome address. Chen Seong, whenever you're ready.
Thanks so much, Arun. Hope everyone can hear me. I'm sure you can. I think I'm unmuted. Great. So I think it's a significant World AIDS Day this year. World AIDS Day, as we know, always falls on the 1st of December, and it's really to commemorate not only the advances we've made in terms of HIV since it was first discovered, but also to remember those who are still suffering and still living with HIV. It's a momentous one this year because for the first time we have gathered the different HIV care programs to observe HIV together. And maybe I will let Professor Liu Yisin tell us a little bit about why we decided to have a shared event this year. And then I will speak to you after that. So Prof. Liu, over to you.
Thanks, Chen Seong and Arun and the organizing teams and everybody attending these sessions, including many of our colleagues who are also providing HIV care in many different places. I just to echo what Chen Seong had just mentioned, we are particularly very happy in the sense that this year we are together and we are in it together. I still recall, when I was still a very young medical officer many years ago, the first case of HIV seropositive patient was diagnosed in the year 1985. And I took care of him for quite some time until he unfortunately passed on because of malignant conditions that are associated with HIV. And that was first case that was detected in the year 1985, 35 years ago. So I am very sure that along the way, HIV medicines has evolved so much to where we are today. So let's reflect in terms of some of the current official number. We have at end of last year, a total of 8,618 cases, and of these 2,097 unfortunately have died. And we continue to see new cases every year. And of the new cases, we continue to see many of them, in fact, were detected very late into disease illness. About 50% of those presented late into the clinical course. Many of them are, in fact, older individuals, heterosexual, and many of them with lower socioeconomic educational level. So there's still a lot of work we need to do to be able to diagnose them early and give everybody a good chance to be on antiretroviral medications and be able to continue to contribute to the societies. In the year 2018, we saw a dip. We were very happy. And in the year 2019, we continue to see a lower number. This year, however, is very difficult for us to make any conclusions because of the disruptions of COVID-19. But however, I've been urging the teams to look into the impact of COVID-19 on HIV in terms of transmissions, in terms of medical care, and in terms of the outcome. So I think there's still quite a fair bit for us to understand how these two viruses interplay. And moving forward, I'm very pleased this year that we bring together all the institutions and all our colleagues caring for HIV medicines, and we are in it together for this round and many more years to come to be able to continue to combat HIV, providing a good care to our patients. I will pass the time over to Chen Seong. Thank you for your attendance, and I hope everybody enjoyed today's meeting.
Thanks so much, Prof. Yes, so as Prof mentioned, it's this year's World AIDS Day is significant for a few reasons. I think 2020 has been a weird year for all of us, but we really wanted to continue to observe, what is really a significant date on the calendar as far as HIV is concerned, and that is celebrating World AIDS Day. In recent memory, and definitely as long as I have remembered, this is the first time that we have all the programs together to observe World AIDS Day. and I think echoing Prof as well, in this challenging time, we just want to make sure that we stand together and continue to do what we need to do as HIV physicians. Now, maybe what I'd like to do is just ask the other HIV program leads. I definitely see Daryush from NUH and Ian from SGH are online. Maybe you would like to turn your cameras on and maybe unmute yourself, really just to say hi to everybody who's here. And I will kick things off as you all are doing that, but I really just want to thank and say hi to not only my colleagues and friends from NCID and TTSH, but also those who are joining us from SGH and NUH and Changi. Thanks for taking the time to come and share this occasion with us. We wish we were able to do a joint event in person and see everybody in person, but unfortunately we can't do that at the moment. Hopefully by next year with a vaccine or something, we'll be able to do so. Ian, over to you.
Okay, hi. So good afternoon, everyone, and thank you for joining us today. I'm Ian, the lead for the SGH HIV program. So the SGH ID department, together with Simon, our nurse clinician, and Jasmine and Vivian, our MSW, take care of about 600 patients in SGH. So Wellaids Day remains as relevant today as it has always been. And while we have come a long way in terms of treatment over the years, there's still a need to increase awareness and correct misconceptions of HIV, to end stigma and discrimination, and of course to improve the quality of life of PL-HIV. So I think the event today acts as a reminder that HIV has not gone away, and definitely there's still much work to be done. So yeah, over to Darush.
Darush, you're muted.
You're muted.
Yes, Arun just sent me a message. Thank you. So I'm Dariusz Olszna. I am a clinical program director of the NUH HIV program. We are very happy to be part of this initiative today. And indeed, it will be so much nicer to actually be able to meet physically. But nonetheless, it's a great initiative. Just as SGH and NCID, we have a full-fledged HIV program with an HIV clinic and HIV prevention clinic as well. And we are very keen to hear from others today who are contributing to this event. So I hope it will be a good 90 minutes. We're really looking forward to it.
Thanks so much. Jamie, who is our Dr. Jamie Chen, who is the our counterpart from Changi General Hospital, I think is still in clinic. She'll be joining us later on, but I'm sure she shares all of our sentiments as well. I think before we start the first item, I just wanted to share that this meeting and this program today is really meant to be lighthearted, fun, and as you will see in our first item, which is a quiz, quite interactive as well. So hopefully everybody will try and take part. There will be prizes for the quiz, but we really wanted to, every year the events that we hold in our own institutions are really just about raising the awareness of HIV, and as Ian pointed out, addressing some of the issues around stigma and discrimination. But at the end of the day, it's just continuing to talk about HIV, to correct any misconceptions and to increase our own awareness, and hopefully take these conversations back to our own families, our own friends, and continue talking about it, because it's only when we keep talking about it that more and more people understand. And that's what really the spirit of World AIDS Day is about, not least of all this year when it's such an important and significant date. So I'm going to stop talking now, and I'm going to hand the screen and the screen time back over to Arun and my colleague Chiao Yi, and they will start the first item. The subsequent items, as you come to realize, all really have to do about talking to people with HIV and understanding a little bit more about life through their eyes. So that's enough from me. I'll hand the screen time over back to Arun.
Okay, thanks everyone. Well, I believe most of us have an idea of what HIV is, but how much do we really know about HIV? Allow me to invite Dr. Choi Chiao Yi, Associate Consultant at NCID, who will lead through this segment. Chiao Yi, you may take over the screen.
Thank you so much, Arun. Good afternoon, everyone. My name is Chowie, and I will be your game master for this section. Everyone is welcome to join as we test your knowledge on how much do you know about HIV infection. I hope you were all paying attention to the videos and the speakers earlier because many of the answers can actually be found there. If not, well, you're about to learn the meaning of regret. We will be awarding prizes to the top 10 participants with the highest number of points from each institution. So each institution will have 10 winners. The points gathered are not just based on the accuracy of your answer, but also at the speed at which the answer is given. So to participate, please scan the QR code or use the link ahaslides.com/F7B88 that is indicated on the slide. Please put in your name and the institution that you come from so that we can award the prizes to you. So in other words, we do need your actual name, guys. If not, we can't find you. The questions will only appear when we begin the game. So once again, please scan the QR code or use the link to join the game and register using your name and hospital. There's no penalty. This is going to be a lighthearted and fun event, so I would encourage everyone to join in as well and have a chance to win prizes too.
There's no place to put my name.
So initially, when you sign in, you'll notice that it's a blank page. That's normal. The questions will only appear after we start. So let us see the number of participants that we have for the quiz. So once again, this is the format. Please give your name and the institution that you come from. We will start when there is enough players. So once again, everyone, please do join in. Please remember to put the institution that you come from as well. Very good. I can see the numbers are going up. So while waiting for most other players to join, I'd like to remind everyone again, the points are awarded not just based on the accuracy, but also the speed at which you answer the question. So fastest fingers first. Just give it a bit more time. I can see there's still people joining. For those who just joined us, we are doing a quiz now that's quizzing people on the knowledge of HIV. There are prizes to be won. If you're interested to join, please use the link ahaslides.com/F7B88. Join with your name as well as the institution that you come from so that we can award the prizes. The points are awarded based on the speed as well as the accuracy of your answers. So there are no penalties. It's a free and easy game. Just come and join and have some fun with us. We're just currently now waiting for the players to register because I can see the numbers are still going up. Okay, I see about. How do you register? You use the, if you can see the link that is on the top, it's ahaslides, ahaslides.com/F7B88. Join by using your name as well as the institution that you come from. If not, we wouldn't be able to award the prizes to you. Once again, the number of points awarded will be based on the speed as well as the accuracy of your answer. So for those who just join us, if you wish to join this quiz, this segment is a quiz. It's a light-hearted game. You can do so by using the link at the top, which is ahaslides.com/F7B88. Okay, I think the number of players seems quite stable for now. Let me see. All right, it's still going up. Okay. Arun, I think we can begin. Okay, ready. Everyone, this is our first question. Remember, speed and accuracy. What is the symbol of AIDS awareness? Is it A, a blue ribbon, B, a yellow ribbon, C, a red ribbon, or D, a puzzle ribbon? What is the symbol of HIV AIDS awareness? And the answer is C, a red ribbon. In 1991, the red ribbon became an international symbol of AIDS awareness. The blue ribbon apparently has many associations depending on the kind of blue that you're talking about. The yellow ribbon in Singapore represents community support and acceptance of ex-offenders, and the autism awareness ribbon is a puzzle ribbon. These are our leaderboard for the top few players. Do not worry, we still have 9 more questions. Onward to the second question. HIV only affects a group of people who are promiscuous, men who have sex with men, or sex worker. Is this A, true, or B, false? And the answer is B, false. Anyone can get HIV, so it's important that you are aware of the things that might put you at risk. It is impossible to tell if another person is living with HIV just by looking at them. People living with HIV are the same as anyone else. Well done. Now we will be moving on to question 3, but so once again, this is just to have a quick look at your ranking. Do not be worried. Remember, it's speed and accuracy. On to question 3. HIV cannot be transmitted by the following actions. A, mosquito bites. B, shaking hands with individuals living with HIV. C, sharing of food with individuals living with HIV. Or D, kissing individuals living with HIV. Please select any answers that apply. And the answer is D, all of the above. HIV cannot be transmitted by touch or saliva, and not even mosquitoes. A lot of people ask this, but the fact is, number 1, HIV cannot infect mosquitoes. Number 2, when a mosquito feeds on a human, what's injected into us is the saliva and not the blood of either the mosquito or the individual it has fed on earlier. So mosquitoes cannot transmit HIV. Okay, well done. We'll now move on to question 4. Is it possible for parents living with HIV to have a HIV negative baby? A, yes. B, no. And the answer is A, yes. Antiretroviral medicine taken during pregnancy can prevent the transmission of HIV from mother to child. So if parents living with HIV can have HIV negative children. In addition, if an individual is virologically suppressed on medication, they also cannot transmit HIV to their sexual partners. Well done. We'll now move on to question 5. For those who are not yet on the leaderboard, do not worry. Remember, the timing at which you answer the question also award point. Now, question 5. What does pre-exposure prophylaxis, also known as PrEP, do? Does it A, prevents you from getting HIV? B, prevents someone with HIV from passing on the virus? Or is it C, acts as an emergency prevention method when taken up to 72 hours after exposure? And the answer is A, it protects you from getting HIV. Pre-exposure prophylaxis, also known as PrEP, is a pill for people who are HIV negative. When taken as prescribed, it can be very effective at preventing you from getting HIV. Now we'll move on to question 6. Have a quick look at the leaderboard. Okay, I can see some names have changed. Okay, what is post-exposure prophylaxis known as PEP? Is this A, an emergency contraceptive to stop you from getting pregnant? Is it B, another name for HIV treatment which you take if you have HIV? Or is it C, a way of preventing HIV after you have been at risk? And the answer is C. It is a way of preventing HIV after you have been at risk. PEP is a short course of antiretroviral drugs that can stop exposure to HIV from becoming a lifelong infection. It must be taken within 72 hours of exposure. It is not always readily available. It cannot be used as a regular form of protection. Okay, well done. Let us now move on. This is the leaderboard. Okay, guys, just a few more questions. Question 7. An undetectable viral load is when A, the amount of HIV in a person's blood is so low that it is no longer detectable by the standard viral load assay. B, someone who doesn't know their HIV status. Or C, a person living with HIV who is cured of the virus. And the answer is A. The amount of HIV in a person's blood is so low that it cannot be detected by a standard assay is known as an undetectable viral load. Very good. Now we'll move on to question 8. We have only 2 more questions, guys, so everyone do try your best. Now, question 8. A person living with HIV who is on successful ART treatment and who has achieved an undetectable viral load will pass on the virus to their partners. Is this true or false? The answer is B, false. A person living with HIV who has effectively achieved an undetectable viral load cannot transmit the HIV virus to others sexually. This is known as U equals U, undetectable equal to untransmissible. They can live a normal, healthy life and have a normal, healthy, meaningful relationship with HIV negative person. Okay, guys, now let's have a look. I can see that the first 2 names have not changed much. Everyone can try your best. Now onwards to question 9. Can a person living with HIV work in a healthcare setting? By that, we mean nursing, allied health, or administration. A, yes. B, no. And the answer is A, yes. A person living with HIV can be employed if they are involved in things not involving exposure-prone procedures. However, they continue to face challenges during their job search due to stigma that surrounds HIV. Last question. Okay, everyone, that is the leaderboard. We're now moving on to question 10. Should healthcare workers double glove when attending to people living with HIV? Is it A, yes, or B, no? And the answer is B, no. Double gloving does not provide additional protection. In fact, it increases the risk of accidental perforation, especially during procedures. It reduces tactile sensitivity and does not prevent needle stick injury. Okay, guys, that's our last question. Let us have a look at the leaderboard. So these are our top 10 winners. Thank you so much to everyone for joining the quiz. I really hope you have fun while learning more about HIV infection. For those who did not see your name on the leadership board, do not worry, as we will still be awarding prizes to the top 10 participants from each institution. Your winners will be contacted by the program head shortly. Thank you so much once again. I hope you have learned and had fun. We'll now move on to the next section by Dr. Wong Chun Seong, but I'll pass the screen back to Arun. Thank you, Arun.
Okay, thanks, Xiaoyi. Next up, we have Dr. Wong Chen Seong again, who will walk us through the top 10 facts about HIV in the last 35 years. Chen Seong, please.
All right. Thanks so much, Arun. So what I will be really spending the next few minutes talking about is kind of running us through like the top 10 most important facts or things about HIV in the last 35 years. With a special focus, of course, on Singapore, because that's where we are. I just wanted to give a few disclaimers first. This is a top 10 list that is completely personal. It's very subjective. This is according to my own experience and my own thoughts about what are the most important things about HIV. You may not necessarily agree with all of them, but if you don't, it'll be great for us to have a chat and have a discussion about that. Any comments, I'll be happy to sort of talk about as well. You can sort of put in your Q&A or your comments in the chat box. So without much further ado, I am going to go through what are the top 10 most important facts about HIV according to me. Now, the first, of course, is the discovery of HIV, which really took place, depending on who you ask, between 1983 and 1984. So it's about the same age as me. In 1983, doctors at the Pasteur Institute in France reported that they had found a new virus, a new type of retrovirus, which initially they called LAV, or lymphadenopathy associated virus, that they thought could be the cause for this new novel acquired immunodeficiency syndrome, or AIDS, that was, at the time really starting to infect more and more people, more in the Western world initially. Of course, it was much later on that we found out that HIV and AIDS had probably been around for a few decades before that. In 1984, in the US, the National Cancer Institute announced that they had found the cause of AIDS, which was another retrovirus that they called the human T lymphotropic virus 3. But then when they compared notes, eventually they had a joint press conference, and this was in 1984, where they announced that both the LAV as well as HTLV3 that had been found in France first and then in the US later on were actually the same virus and was the most likely cause of AIDS. Now, the name HIV was actually only widely adopted in 1986, when an international committee decided that this would be the cause, this would be the name of this new virus. Most of us will be familiar because we'll realize that COVID-19 really only started being called COVID-19, and the name of the virus, the SARS coronavirus 2, was also decided by this international committee. And so it's exactly the same process, and that's where we get HIV from. Now, the second thing that I feel is important in the last 35 years, of course, is the discovery of the first antiretroviral drug. Some of us will know it as AZT, some of us will know it as zidovudine. And it was licensed in 1987 when the US Food and Drug Administration approved its use in March for treatment for HIV. And for those of us who are, working in healthcare, we will know that actually it takes time between knowing what causes a disease and finding a treatment for it. And even after we discover it and we find that it works in clinical studies and trials, it still takes many, many years before it goes through all of the licensing red tape and bureaucracy and regulations before it's finally being used. But for AZT, the time between we found out that it was active against HIV in the laboratory and being approved for use was a very, very short 25 months, just slightly over 2 years, which is still kind of one of the shortest durations of any such process in the history of medicine. Of course, now with COVID, things are likely to change again. Now, the third thing, I think some of us, especially those people who have been practicing in HIV for some time, is what we call the HART era, the highly active antiretroviral therapy era, which really started at the 11th International AIDS Conference in Vancouver of 1996. Which really, if you ask people who are practicing around that time, will tell you it kind of changed what HIV treatment was like, because it was at this conference where it was shown that if you used at least 3 HIV medications from at least 2 different families of HIV drugs, usually including the protease inhibitors, which at that time were just coming onto the scene and gaining prominence, we really could turn HIV from being a almost always fatal disease for most people within a few years of diagnosis into a condition that is seen as a chronic disease, a manageable long-term illness, a condition where people can actually have it, take medications, and still live long, healthy, happy, and productive lives. So this really was seen as a dawning of a new age and better days ahead. The next one, I think, was kind of talked about by Chow Yi during the quiz, and that is talking about U equals to U, or undetectable equals to untransmittable. Now, all of this really started at the start of this decade in 2010 and 2011, when studies from a HIV research project called the HPTN052 trial, it actually showed that when we started people with HIV infection on HIV treatment early, that means we didn't wait until their immune systems got weak. We started them as soon as they were diagnosed. It not only was very good for their own personal health, but it also reduced the likelihood that they would spread the infection onto their sexual partners by more than 96%. And when they did even more calculations, the conclusion that came about was that people who had an undetectable viral load were just not able to transmit the HIV virus onto their partners. And numerous studies after this first study have gone on to prove and show this same fact. So the U equals to U campaign, undetectable equals to untransmittable campaign, was really launched in middle of 2016, and it was aimed at increasing awareness of the science. Oftentimes, all of these research studies are not publicized widely. They stay on the pages of science journals and scientific journals and medical journals, and not everybody in the general population knows about this. But this is a very important finding, because it basically tells us that HIV is not easily transmitted as long as people are on treatment and have an undetectable viral load. And this can actually really help at reducing the stigma and discrimination faced by many people living with HIV as a result of fear of transmission. Now, the fifth sort of landmark and milestone that I feel is important in HIV history is really the fact that we have found a way to quite significantly and effectively reduce the transmission of HIV from parent to child or from mother to child, and in so doing, really try and keep future generations HIV free. And how do we do this? This is not new. In August 1994, the United States Public Health Service actually recommended the use of AZT. Remember that very first drug that was discovered for HIV use to prevent mother-to-child transmission of HIV. And this was from a study that was called the ACTG-076 study, which was done in the early 90s, which actually showed that for mothers, or pregnant mothers or women who had mild HIV disease, not previously treated with any HIV medications and were given AZT, it actually reduced the risk of transmitting the virus onto their unborn children by more than 66%. So it reduced the likelihood by 2/3. Of course, the science has progressed even further from then, and we now know that the most important thing for pregnant women to reduce the risk of transmission onto their unborn children is really to get them on treatment and make sure that they're virally suppressed. And this has prevented untold millions of infections to children who are born from pregnant moms with HIV infection. The sixth thing that I want to talk about is HIV PrEP. I think Chow Yi talked about this in the quiz. Many of you got it correct. We now know that using specific combinations of HIV medications when you are HIV negative can actually prevent you from being infected with HIV if you're at risk of HIV infection. And this is really a very powerful addition to our toolbox that we have for HIV prevention. For a long time, we have relied on things like A, B, C, and D. Of course, abstinence, being faithful, the correct and consistent use of condoms, and early detection, which of course is very important. We cannot overstate how important these are. but PrEP is a really good addition to these tools that we have. And also PrEP is something where the control is really in your own hands for HIV prevention. We have to remember that A, B, C, and D really require two hands to clap. Both partners need to agree on abstinence, both partners need to agree on faithfulness and the use of condoms, but PrEP places the control of HIV prevention solely in the hands of the person who's at risk. So I'm sure all of us here, especially those who are a bit more familiar with PrEP, will be happy to talk more about PrEP. We are always talking about PrEP. So, hit us up and we can chat more about this. Now, the seventh important landmark is what we call the 1990. And I'm not sure how many of you in the room are aware of this, but in the mid 2010s, the early 2010s, the UNAIDS, or the United Nations HIV and AIDS program, set these ambitious goals for 1990. And what this means is that they want 90% of all people who have HIV infection to be tested and be aware of their diagnosis. Of all of the people who know that they have HIV infection, they want 90% of them to be on HIV treatment. And for all people who are on HIV treatment, they want 90% of those to have an undetectable viral load. And the reason for this is that we have predicted that if we achieve these 90 goals, then we can potentially stop all new infections of HIV by the year 2030 and effectively end the HIV pandemic. Of course, these are ambitious goals. Currently, the world is not quite on target to reach these goals by 2030, but what it has given us is a goal, a stretch goal for us to reach towards, to work towards the same targets internationally. And I'm happy to say that in Singapore, we are moving towards achieving these goals. Our third 90 is already more than 90%. So we really just need to get more people tested. But just remember, 90 is something that's easy to remember and gives us a goal that we can work towards and achieve. Number 8 is HIV vaccine. And you'll ask me, why is this important? How do we already have a vaccine? And the answer is no, we don't have a HIV vaccine yet. But it's not because we haven't been trying. In fact, the first clinical trial for an HIV vaccine started in 1987, which was just a few years after the discovery of the virus. And to date, we still don't have an effective one. And this just shows you how complex and complicated HIV is as an infection and how difficult it is to develop a vaccine for it. It remains one of the most active fields of HIV research, and in fact, one of the most active fields of clinical and medical research, full stop. And many of the things that we learned about developing vaccines and viruses from working on HIV vaccinology have actually gone towards helping us develop a COVID vaccine, or the successes that we have in COVID vaccine development, so that between the discovery of COVID less than a year ago to now, where we have so many promising vaccine candidates to bring an end to the COVID pandemic, have all been due to the work that was done on HIV vaccines. So, just in the next 2 or 3 years, there will be numerous other HIV vaccine trials that will be getting off the ground. So I still put it down there as an important part of HIV history. We talked about the red ribbon in the quiz as well as an instantly recognizable symbol for HIV and AIDS. I think nowadays, if you see this red ribbon anywhere, you will know that the cause that we're talking about is HIV. And this was really launched in 1991, and it is still a symbol around which we can recognize HIV and try to fight the stigma and discrimination that is associated with HIV still. And the last thing is really just talking about some of the landmark things that have happened in Singapore with regards to HIV, and to talk about what a way that we have come, right? Prof. Leo talked about this year being the 35th anniversary of HIV in Singapore. 1985, that was when the first case was diagnosed. Straight away that year, a national advisory committee was formed that has since evolved over time to become, in some way, shape, or form the National HIV Program. In 1988, Action for AIDS, which is the longest serving and largest community-based organization working on HIV/AIDS causes, was formed. In 1996, 1998, we had the advent of HAART, or highly active antiretroviral therapy, in Singapore. In the nearing 2010, we started to be able to use MediSafe for antiretroviral therapy, which allowed HIV treatment to be much more accessible. In 2017, the first HIV PrEP clinics were set up in Singapore. And of course, this year, 1st of September, is another landmark milestone where for the first time, some of you may have heard, HIV medications were put on the standard drug list, which means that for Singapore residents, there's an automatic subsidy enjoyed for HIV treatments. And hence, it's a step towards treating HIV just as any other chronic disease like hypertension and diabetes, which also have medications on the standard drug list. So I think even within our small nation, we've had an illustrious history and heritage of HIV, and it's something that we really want to talk about and commemorate this year and today. So thanks very much. That's my completely subjective list of important things that have happened in HIV history. And I hope it's given you something to think about, something to talk about with your friends and colleagues, something, maybe find out more about, Google more about, or if you hit me up, I'll be happy to talk about this. Most of my friends will know that I talk about very little else apart from HIV anyway. So thanks very much, and I'll hand it over back to Arun. Thank you.
Chen Xiong, there's a question in the question box for you.
Yes. Is there any plans to make U equals to U into a nationwide campaign? That's an excellent question. I think we are moving quite carefully with this because we really want to, as with all new campaigns and with all new technology, we want to sort of talk about it in a way that is most beneficial to everyone. And I think definitely as clinicians, and Daryush and Ian will tell you that, this is something that we tell our patients in clinic. And the reason why we're talking about it at a forum like this is because we want to raise awareness about it. But whether it's going to become a nationwide campaign in just this shape and form, U equals to U, it's something that we are working on, and we hope that we'll be able to introduce our own local flavor to this campaign in the not so distant future. So, watch this space, definitely something that we are looking at. Thanks for that question.
Okay, thanks, Chen Xiong. So have you ever wondered what a person living with HIV goes through in their everyday lives? Let me invite Noor Rafika to walk us through her life as a person living with HIV. Chen Xiong and Noor Rafika, whenever you're ready.
Okay. Can I just check that? Hello.
Hi.
How are you?
Fine.
Okay, so for everybody who's joining in, I'll just introduce Noor Rafika. Rafika is a friend and a patient of mine, and I've been taking care of her for quite some time now. So I thought, we'll just have a chat and invite everyone to, invite her for a chat, ask her some questions about her life, and we'll see how things go. So, Noor Rafika, what are you doing now with your life?
I'm currently a second-year student at a local polytechnic, taking a diploma in electrical engineering, specializing in biomedical.
And is this something that you've always wanted to do?
Yep.
That's great. So, apart from school, I'm sure you have like hobbies and other things that you like to do with your life, right? What are some of the hobbies that you have?
During my free time, I love to play bowling and also photography.
Photography? Oh, okay. Is there anywhere where we can see your photographs?
Have Instagram.
On your Instagram. Okay, so everybody, you can go and follow her on Instagram. Now, I wanted to ask you, what are your ambitions? What are you working towards?
My ambition is to become a biomedical engineer, as I find that MRI and CT scan machines to be very interesting and develop an interest in this area. And I would like to learn more about it.
Okay. MRI and CT scans. I mean, they are quite interesting. fun to know so how they work. I mean, we use them all the time, but we don't often think about how they work. Now, Avika, I wanted to ask you about some plans for your future, like short-term, medium-term, long-term plans, right? What's your plan for the next 1 year?
For the next 1 year, I aim to finish my diploma and to graduate so I can pursue my ambition.
Next 5 years?
Next 5 years, to work as a biomedical engineer and also to take a part-time degree at the same time.
Okay. And then next 10 years?
Next 10 years, to still be working in the same sector. But at the same time, I aim to be financially stable, to support myself and my family, and to travel the world if possible.
Okay, that's great. Hopefully by then, I mean, okay, 10 years surely we'll be able to travel lah, huh? Now, I wanted to ask you, Afika, you know, if you don't mind, how did you find out about your HIV condition?
I find out about my diagnosis accidentally when I was 12 years old. It was during one of my parents' appointment when their doctor said HIV loudly to them.
And, you know, how did you feel at that time?
I was angry
Mm-hmm.
because no one told me what are the medications are for.
Okay. Maybe we'll talk a little bit about what your treatment journey has been like. You know, what's the first treatment that you can remember? You know, you said that you were taking medications.
Since I was diagnosed, I took 2 types of medication, syrup form, and I take it 3 times a day until I was about 7 or 8 years old.
Okay.
Then after that, from there onwards, I started taking tablets for 2 times a day until I got transferred over to Tock Seng.
Okay, and what's your current treatment like?
Current treatment, I have to take 4 types of medication, total of 5 pills every night.
Okay, so the difference between what you were taking last time and now?
The difference is now I only have to take my medication only once a day.
And is that better for you?
Which is good lah.
Okay. So oftentimes, when patients talk to me, they're like, oh, how can treatment fit into my daily schedule, right? So, what's your daily schedule like?
My daily schedule is like, I will still go to school as per normal, just like any other polytechnic student, to attend lesson. And then after school, I will hang around with my friends to study lah.
Okay. And how does medicine fit into that? Is it inconvenient?
Usually I take my medication at 11 p.m. every night.
Okay. And how often do you come to clinic?
I go to clinic once every 3 to 4 months for my follow-up. But 2 weeks before, I will come in to give my blood to check my CD4 count and viral load. Okay.
And Afika's viral load has been undetectable for quite a few years now. Very good. Now, I wanted to ask you, and sometimes as doctors, we don't often think about it, but maybe from the patient's point of view, how do you think HIV treatment can be improved to make your life better?
Having more medication which are not currently accessible, such as having more types of 1 pill treatments.
Okay.
More subsidies for HIV medication.
Okay.
Having GPs to have more knowledge about HIV and also about U equals U. Having schools to have sensitive training for their staff about HIV, because many people are misinformed about HIV and have outdated thinking about it. And lastly, having mental health support for PL-HIVs.
Mental health support like what? What kind of mental health support do you think?
Like seeing the psychologist to talk about their life, like how they're coping with their life.
Okay. Okay. So I think those are all sort of really, really great ideas, and it's really refreshing and quite powerful to hear this, from somebody who's actually been through that journey. So thank you very much for sharing. And maybe the last question that I want to ask you is, if you were to meet somebody who's newly diagnosed with HIV today, what kind of message would you want to tell them?
You are not alone in this, and that this isn't the end of the world. Seek treatment as early as possible, and with the right treatment, you can live a normal life just like everyone else.
Okay, so thank you very much, Nafika, for sharing. I know you're probably very busy rushing off somewhere, jet-setting lifestyle. So, thanks so much. I know that there are some questions that have come in from the from the chat, but I know that you're in a rush. So maybe what I will do is I will convey these questions to Norafika, and maybe with some of the answers we can disseminate them to the rest of the chat group in an email later on. So thanks very much. Thank you very much. Have a great day.
No problem.
So I really wanted to just thank Norafika once again for being so open and taking the time to really speak to us. It has taken, Norafika and I have been on a journey with and I've learned so much just from being her doctor and walking this this road with her over time. And when she told me that she was willing and wanted to actually come and share her story with us on this World AIDS Day, it was very moving and very touching to me, actually, and I'm so glad that she took the time to do so. I know that there are some questions that are directed at her. I promise you I will direct these questions to her, and we will get the answers to you in some way. All right. So thanks very much for giving both Norafika and I this time. I'm going to hand the time back over to our MC, Arun.
Okay, thank you, Chen Seong and Norafika, for the honest sharing of your experience living with HIV. Next, let me invite Dr. Tay Ian, HIV Program Director at SGH. She will share more about the experiences of her patients living with HIV and their hopes and dreams for the future. Ian, over to you.
Thanks, Arun. So our team at SGH thought that perhaps World AIDS Day will be more meaningful with some patient participation. Our team conduct a patient support group called Empowered Living twice a year. And the original idea was to actually make a short film with our patients during one of these sessions. But as we all know, this year another virus took the center stage, and we had to put this on hold. But we decided to proceed on with a video, which has now taken a different form. So let's move on to see what our patients have to say. Okay, so we thank our patients for taking the time to share their stories with us. During this time, some of our patients have lost their jobs. Others struggle to find a sense of belonging and a place of acceptance in their families and relationships. One patient actually shared that he got a job as a swabber so that he can continue to support himself and afford his medications. So their lives and stories are an acknowledgement that disease or no disease are fundamentally the same. We are all human, capable of displaying resilience and motivation, and HIV cannot change that. So we hope that you've enjoyed our short video. So thank you, and I will hand it over to Arun.
Thanks, Ian, for shedding light on the hopes and dreams of persons living with HIV. As healthcare providers, it is our responsibility to make patients feel safe and treat them with love and compassion. On that note, allow me to invite Dr. Ho Lai Peng, Principal Medical Social Worker at NCID, who will share findings on the HIV knowledge and attitudes of healthcare workers in the community healthcare facilities. Lai Peng, whenever you're ready.
Good afternoon, and thanks for joining us for this World AIDS Day event. Earlier on, we have covered a lot on HIV facts, but how much do healthcare workers know about these facts? Okay, so I'm going to share survey findings of HIV knowledge and attitudes of healthcare workers in community healthcare facilities. This was a survey which was conducted in May July this year, prior to running HIV workshops at these healthcare community healthcare facilities. So the objectives actually of this survey is to understand the level of HIV knowledge among healthcare workers in the community healthcare facilities, as well as to assess the preparedness to care for people with HIV, because these facilities were going to take in patients with HIV. So what we did was we used a Google form to administer the 28-item survey, and these items consist of modes of transmission, the knowledge about treatment, HIV treatment, as well as how willing and prepared they are to take care of someone with HIV. There were 596 respondents, about 75% were female, 80% between the ages of 20 to 39 years. Right. Most of the respondents were nurses, and they have a diploma or a degree. So generally, most of these respondents were aware of the common modes of HIV transmission, which is unprotected sex, vertical transmission from mother to child during pregnancy, sharing needles, and receiving contaminated blood and blood products. However, about 32% agreed or were unsure if toilet seats and insect bites could transmit HIV. And 35.2% thought HIV could be transmitted from being in close contact with someone with HIV. So we have covered these, and you all know that you cannot get HIV from all these things, not from toilet seats, not from insect bites, and also not being in close contact with someone with HIV. There were also concerns about sharing of food. So although 75% were aware that HIV is not transmitted through sharing of food, 61.4% would not or were not sure if they would share food with a person with HIV, and 60.5% would not or were not sure if they would buy food from someone with HIV. Actually, when we set up the HIV Patient Care Center at the OCDC in 1997, we actually had a kitchen, and this kitchen was used for preparing food for staff as well as for patients. We wanted to show people, the public as well as patients and their families, that this is not how HIV is transmitted. So many of us had eaten the food cooked by HIV patients. We have shared food with them, and we can say with absolute certainty that none of us got HIV. And I must tell you that these people included Dr. Wong, Prof. Leo, and a lot of us who are sharing today. So, this is something that has been very difficult for us to debunk, the myth that, you can get HIV from food. But, it is something that we are continuing to work on. And we hope that someday this would be something that is that would not be a problem, for people who work in the F&B industries especially. So how about knowledge about HIV treatment? So just slightly more than 50% of the respondents thought HIV is treatable. 69% were aware that early diagnosis and treatment of HIV could prevent the onset of AIDS. So what's the attitude towards providing care for people with HIV? So out of 100%, 67% of these healthcare workers were willing to care for a person with HIV. 37% were not confident of caring for them, and more than 60% had concerns that they could be infected just by caring for these patients. So actually this information allows us to work on our material for education, and then to change certain perceptions and prepare them to take patients with HIV. And we actually had 2 runs already. We had one run with 70 participants, and another run with 200 participants. And I think the outcome is not too bad. You know, we are going to analyze the information and the data at some point, and we hope that the more people will have a better knowledge of HIV, and they'll be more willing to take care of someone with HIV. And I always like to ask the question if they would like to know if the patients they are treating or they are caring for has HIV. So more than 90% will expect to be informed of the HIV diagnosis. However, if they have HIV, if these healthcare workers have HIV, 60% of them would want to keep their diagnosis a secret. So there's this disconnect actually, because they know that they want to keep it a secret, but they would expect to be told if someone has HIV. So the results actually show that healthcare workers in the survey have some gaps in HIV knowledge. A fairly significant number of have concerns about caring for people with HIV, and many were not prepared to care for them. So I actually I did a study, a qualitative study a few years ago, and the survey findings actually show that the fears that the HIV patients experience were not unfounded. Okay, so these were some of the quotes that I got from the study. So they actually struggle between normality and societal stigma, because HIV medications actually give them a sense of normalcy. They can have good health, they can continue to work, they can continue to be engaged in social life, but they cannot tell people about their HIV diagnosis. So Martin said, living with it is not difficult, as in I actually cannot feel it at all. In fact, patients with other medical conditions, other chronic illnesses, actually feel that the other illnesses were more difficult to manage. And Joe said, HIV is a very normal illness, but in the eyes of others, it's not a very normal kind of illness. It's a very dangerous illness. So while HIV medications give them some form of normalcy, societal stigma actually threatens their sense of well-being. So there's also a fear of disclosure. So Mary said, at least if you have cancer, people will say this is cancer. If I tell people that I'm an HIV patient, what do you think their response will be? Nobody will feel sorry for you. They'll say that you are promiscuous. She has been living with HIV for more than 20 years. And she has been experiencing this for a long time. And even until now, she still feels that she cannot tell people about her diagnosis. And they have also, our patients, many of them actually told me about their experiences with stigma and discrimination in healthcare institutions. So John said when he was in hospital, he was asked why he used a different meal box, whereas other people have the normal utensils. And then on top of the box, there was a piece of paper which states that he has HIV. And he was in a common ward with other patients. So he actually had to hide these notes. So when I saw him, he actually collected these notes and showed them to me. Actually, putting patients' diagnosis where others can see is tantamount to a breach of confidentiality. And under the Infectious Disease Act, disclosure of HIV diagnosis by healthcare workers is actually a punishable offense. So what are the challenges that we have and we continue to face despite many years, that HIV has been with us for many years? So, we have got a lot of advancements in terms of medicine, HIV medicine, but knowledge and attitudes towards HIV and people with HIV continue to lag behind. And stigmatization and discrimination of people with HIV has evidence, is that it will prevent them from seeking help or treatment if they know or they anticipate that they could be discriminated or stigmatized. So this survey shows that it is important for healthcare workers to be educated about HIV, and HIV education should be updated and incorporated as part of the curriculum in medical and nursing schools. Just now we had the question asking whether you need 2 pairs of gloves, because this is something that I saw nursing students, they actually came in with to see a patient and taking parameters with 2 pairs of gloves. And this was what they were taught in school. So I'm not sure if it has been updated, but for all of us, more than any other settings, healthcare institutions should provide a safe space for people living with HIV to seek care without fear of being judged. All of us have the responsibility and duty to ensure that patients under our care will feel safe. So it is this hope that we all have when we organize this event, that we will be updated about the medication, the things that patients can do, HIV patients can do, and to know that HIV is not spread through casual contact with people with HIV. And this is something even before medications. We know for a long time that it cannot be spread through food, but it continues to baffle us as to why people with HIV society do not have this knowledge. That's why I'm going to leave you with the last slide, which tells you that you cannot get HIV from toilet seats, from telephones, from mosquito bites, from even sharing hot pot, and from doorknobs. So I thank you, and I hope that this today will give you more information about HIV.
Okay, thanks, Lai Ping. I believe as healthcare workers, we can all play an important role in reducing stigma and discrimination by offering support and speaking out to debunk myths and stereotypes about HIV that we hear from others. Have you ever wondered what questions people living with HIV would like to ask their physicians? Let me invite Dr. Darius Ozana, Clinical HIV Program Director at NUH, and Daniel Lum, HIV Program Manager from NUH, to share some of the questions and answers. Guys, whenever you're ready.
Hi, my name is Daniel. I'm going to also introduce a friend of mine named Mr. Evan Tan, a community HIV advocate. So we asked, we gathered questions from the community, and Evan Tan helped me just to ask what a physician thinks and what they do, what they eat. So things you want to know about a physician, an HIV physician. Evan, would you like to say something, or how?
Hey, hi everyone. My doctor is not Darius, but my doctor is Chen Xiong. But as a patient, I also have a lot of questions to ask, and when I meet new clients, they also have a lot of questions that they want to ask, but they're very afraid, because like sometimes doctors are being held at a higher regard, and then they feel like it's a stupid question and I don't dare. Maybe should I ask? Should I not ask? So here are some of them today.
Yeah, and when you start working with doctors, you don't really feel afraid of asking these questions. Okay, so I'll go first. Are you ready, Dr. Darush?
Yes, I'm ready. Probably we should give a disclaimer that I do not know what you will ask me. So if I suddenly stutter or don't know what to answer, please forgive me for that.
So we'll skip the question.
Looking forward to the questions.
We will skip the question if you decide to pause for more than 10 seconds. Okay. Okay. So the first question is, why did you want to become an HIV doctor?
That was very long time ago. So when I was studying medicine, just like most medical students, at first I wanted to be a cardiologist or gastroenterologist, so these cool specialties. And I was studying medicine when actually there were not many drugs available for HIV, and it was this relatively new virus that was ravishing through many communities, and nobody really knew what to do about it. Everybody was scared of it. So it was something that was definitely very, challenging from a medical point of view. And then I did my first rotation as a student on actual ward in internal medicine, and I ran into a patient who was so that was in the Netherlands, and it was an Indonesian patient who was admitted basically with blindness in one eye, and he did not want to take the simple ARVs that we had at that time repeatedly. And he told us that he didn't want to do it because he just his partner died from HIV recently, and he just did not want to go on anymore. And then I thought, what a horrible virus this is. And I think that's what really made kind of switch in me that I wanted to work and do something about it. Yeah, I think that was the moment. Yeah.
Okay.
So it was more. So the moment where it was not just it was no longer just a virus or a medical condition, but more than that.
Okay, thanks.
Thanks, Dr. Darius. I think, I have not experienced those myself, but from what I've gathered from people who have lived through HIV during the earlier days, especially I've also heard stories of the late Mr. Patty Chu. Towards the end of his journey with us, he also had trouble because there was just so many pills, and some of those pills were making them feel very, very sick, and they rather not take the pills. When I was diagnosed, I remember it was still standard for me to wait until my CD4 count dropped below 350 before treatment was initiated, because treatment was still quite toxic then. So yeah, I share some of those, but I've not experienced the full weight of that, because treatment for me is so easy today, just one pill, two pills, right? So if not for a HIV doctor, what would your desired profession be? What would you have done besides this?
Oh, good question.
I know.
You know what?
No,
I don't know.
Yeah, you know.
I'm kidding.
No, I don't know. I really, because I went to medical school when I was 18, so it was very long time ago. If I were not a doctor, I have no idea. Really, I'm sorry, no idea. Medicine and being a doctor has been part of me for so many years that, and of course, when you're a child, you want to be a pilot and that kind of things when you are very young. But when I was a teenager, actually, yeah, I wanted to be a doctor. Although to be honest with you, my parents wanted me to be a doctor, and I kind of went on doing that because there was kind of expectation. And I never realized how lucky I was that this would turn out to be a profession that I really love, even though I was actually quite strongly stimulated by my parents to go to medical school.
Were they doctors too?
No, not at all. Usually, at least where I come from, if you are a doctor, you will tell your children, don't become a doctor. Choose another profession. Too many long hours.
Okay, let us know if this question triggers post-traumatic syndrome. Okay. Okay. So I guess before becoming an HIV doctor, did you know anyone living with HIV?
Not before. Not that I knew of before becoming a doctor. But once I became a doctor, I did know people who lived with HIV. And I knew them not through my professional capacity, but that was all after I became a doctor. Yeah.
Okay.
What was your?
Sorry, actually, no, correction. Is there? But do you mean I met people like that, or we were more like friends or connected?
Friends or connected before you became an HIV
okay.
DM?
Okay, no, actually, no.
Well, there are many great empty windows, when we went to Amsterdam for the AIDS conference then. Could be a profession you could consider. There are many a great window along the railway district. So what was your idea of HIV then, and what's your idea of HIV today?
So then, as I mentioned before, this horrible, basically incurable disease And I think a keyword for me when thinking about HIV then was fear. You know, for many people, fear of getting HIV. For people who lived with HIV, fear of dying from HIV. I think that was really predominant, and a bit of helplessness, you know, like especially in the early days. And when you compare it to what we, let's say, my thoughts of HIV now, I would say the keyword now is more and more control, more and more control. And when I say control, I mean it at every level. What I mean by that is, of course, as a doctor, you can control HIV in your patients in a medical way. As a patient, as a person living with HIV, you can really be in charge of your health and make plans for your life without any expiry date, because life expectancy is normal. As a person who may be belonging to key affected populations or being at risk, you are now also in control of not getting HIV. You know, we have PrEP, for instance. Again, people living with HIV with U equals U, control of your relationships. So I think that's really, to me, control in that very broad spectrum with many, many aspects is what really we have now what I think about HIV now as compared to many years ago.
Yeah, I really love that word, because I think a lot of patients, especially newly diagnosed individuals, they feel like they have lost control. They've lost control of their life. They've lost control about their privacy, their sexuality, their financial costs, you know. And so I really love that word.
Yes, and I think we all have to work together even harder to extend that control, because I think that there are still gaps in control in lives of people living with HIV. And I'm thinking basically hinting towards stigma and discrimination. I think we do not have control over that yet, I think.
Well, I mean, speaking of word, you can only pick one word on the top of your head. So, so pick one word to encourage your patient to have better or great sex.
To encourage my patients, to have my patients with HIV?
Yes.
Undetectable.
Okay.
Yeah, and I see you wear that badge very proudly every day.
Yes, I have it now too. My badge, indeed, and this is always on my badge.
Are you still afraid of HIV, despite having so much to control, that we have control over it now?
No, I think that there is no reason for people to be afraid of HIV anymore. I really think so. And it doesn't matter from what perspective you are looking at this, whether you are a healthcare provider who may get a needle stick injury from a person living with HIV, or you are a family of people living with HIV, or maybe a long-term partner of a person living with HIV, maybe a casual sex partner of a person living with HIV, a person living with HIV, you know, anybody around them. I think there is, I don't think we really have to fear anymore of passing HIV to others. So I think that that fear really should be gone now. And if it is not gone, then it means that we need to work harder to make people aware of how far we have come. And I think also, you know, when to give you an example, when we see people in our PrEP clinic, for instance, one of the benefits of PrEP that I always share with my clients who are requesting PrEP is that one of the benefits is not just that it will protect them from acquiring HIV, but that it will also remove fear from their life that may have been there for many years. And that applies also, of course, to U equals U.
Okay, so next question will be me again. And you've seen me in the clinic or meeting destroying people's name. So how long do you go before your patient correct you of their names? How many visits before they say, doctor, this is not my name?
You mean by because my pronunciation is wrong?
Either way, or
well, I do not tend to call patients by completely different names that they have. I'm not that bad, but it's true. I'm very bad with names. Pronunciation may not be great, but surprise, patients in Singapore are so polite towards the doctors. It was one of the biggest cultural shocks to me when I came here from Amsterdam. How polite and nice patients are to their doctors. So I think, actually, I have never, even though I have made multiple mistakes in pronunciation of my patients' names, I have never been corrected.
Okay.
What is the most important thing in your life right now? This is a ninth question, by the way. So we have one more question to go.
Oh, yeah. At this moment?
Yeah.
For COVID to be under control, because that has affected my life quite a lot. And if we can get control of COVID, then it will make things much easier for me.
So to end this off, and happy World AIDS Day to everyone, I get the last question, and this is a very unique question. We heard you speak Thai and Chinese, right? You know the language Thai and Chinese. Can you teach us a naughty phrase in Thai and in Chinese?
I know, I'm sorry, I cannot do that because I'm representing NUH, and it would be very, very inappropriate for me to say any naughty things, even in foreign languages. To be honest, in Chinese, believe it or not, I do not know any naughty phrases in Chinese. So maybe there is still some way to go in my learning of Chinese, which is very, very basic.
That's a very good answer. Very safe, good answer.
No, I'm sorry. I think the Corpcom of NUH will immediately terminate this Zoom meeting.
And I don't think you should be getting your boss in trouble like this.
Yes.
Very bad for you.
Okay, thank you very much.
Thank you for the questions. Really great questions. Thank you.
Thank you, Dariush, Daniel, and Avin for the insightful segment. It is now my pleasure to invite Dr. Jamie Chien, who is the HIV Program Director at CGH, to share some anecdotes about her patient's journey living with HIV. Jamie, over to you.
Hi all. Thank you and congratulations for staying till this last segment of our World AIDS Day program. I represent Changi General's HIV program, which is actually the youngest amongst the public HIV centers in Singapore. So even though we are the youngest, but our operations has started since a decade ago. And in Changi General Hospital, we are fondly known as the Z Clinic. Next slide. I will take a lot of pride to actually present my 13-member team, which consists of 4 attending doctors next. Myself, Dr. Raymond, Humaira, Dr. Tan Xiaoyan, and my 4 nurses here, Irene, Catherine, Nagesh, as well as Diana, my 4 pharmacists, Jonathan, Wilson, Vincent, and Shoki, and my one and only beloved social worker here, very strong member here, Fadila here. Next. And each year, while we take our time to reflect our response to enhance the HIV epidemic and ending this year, we hope to enhance our healthcare workers' awareness to HIV infection. These are still some photos of our recent gatherings during COVID. Next. I'm pleased to introduce a follow-up patient of Dr. Tan Xiaoyan, and Peter will actually share his views on HIV as well as his health journey through this short audio interview. Next.
40% of newly diagnosed HIV patients are diagnosed late in the stage of illness. Many local patients are not aware of their status or are fearful of screening. From your perspective, what do you think are the challenges to patients receiving HIV care?
Ignorance or misinformation. Many people are unaware of the symptoms of HIV infection and may dismiss their symptoms as minor and may not seek medical attention. I hope that people will pay attention to the signals that their body gives them. For example, if you take very long to recover from a cold, or you still feel sick after multiple courses of medication, these may all be symptoms of poor immunity. Secondly, fear and stigma. People are fearful of being identified or labeled when diagnosed with the HIV infection. They lose hope and become uncertain of the future. Many still think that HIV is a terminal disease with no treatment and associated with death. It is extremely scary to think about, and people avoid getting tested due to fear. I believe that if patients know what to expect during the treatment course and that care is readily available without prejudice, more patients will accept treatment. It is very reassuring to know that the prognosis for most patients are good and they can expect to live a normal life. In my case, since I started treatment, I feel better than ever. It is said that cancer patients receiving cancer treatment are perceived as brave warriors, but patients with HIV are sometimes treated like criminals. Fortunately, I've received dignified and great care from Dr. Tan and her team of healthcare workers. I hope that there will be more of such healthcare heroes recognized in this fight against HIV.
How do you feel so far since you have embarked on your journey to receive care?
I feel blessed. I've come a long way as a patient who was diagnosed in a late stage of the infection. I attribute my recovery to the CGH team of nurses, doctors, pharmacists, social workers, and many more. All of you played a role in my recovery, and I am grateful.
Do you have any words to say for others who are still living in fear or contemplating getting themselves tested?
I want to encourage those who are afraid of being diagnosed. This is similar to a chronic illness, and it can be managed just like how diabetes or high blood pressure patients are managed by their doctors. Looking back, I wish I had tested myself earlier and started treatment sooner. I would not have to go through the ordeal of the severe illness and poor health back then. 3 phases I hope to share: get tested, have faith, and get treatment.
HIV does not discriminate. It can affect anyone regardless of social status. Get tested for HIV if you are at risk. Effective treatment is available and you can live a normal life. U equals U. Undetectable equals to untransmittable. This explains how sexual transmission of HIV can be stopped. When a person is living with HIV and is on effective treatment, it lowers the level of HIV in the blood. When the levels are undetectable, HIV cannot be passed on sexually anymore. Get treated and you can protect your loved ones from the virus.
Thank you, Peter, for sharing his journey with us, and Xiaoyan for donating her voice as well as a picture. And this is a call out to all healthcare workers. Let's stamp out our stigma and throw out all this misconception about the transmission of HIV. And we can walk alongside the persons living with HIV. Join us in our fight against HIV. And for that, thank you very much. I'll hand back to Arun.
Thank you, Jamie. Indeed, HIV is no longer a death sentence. With early detection and treatment, it is possible to lead healthy and fulfilling lives. With that, we have now come to the end of the World AIDS Day event. Let me invite Dr. Wong Chen Seong to give his closing remarks. Chen Seong, please feel free to take over the screen.
Hi, everyone. Thank you so much for taking your lunch time on this World AIDS Day 2020 to share with, to spend this time with us and listen to the presentations and the sharing, not only from those of us who have been working in this field, but also from people living with HIV themselves. I just want to thank you once again for coming. I want to thank Dariush, Ian, Jamie, as well as all the other representatives from the other hospitals and, of course, NCID and TTSH for taking time to put together this program. I want to thank all of the people living with HIV who shared with us their experiences. I believe that we have learned more than anything else that we can learn from the books and so on. And last but not least, I want to thank Arun, Li Xuan, Christine, ST, and the rest of the organizing committee who helped pull together this program. I hope that all of you had a great time. I hope you all participated in the quiz, learned something. But most importantly, I hope that you will at least today go home and talk to one or two other people about something that you saw, heard, or learned in this afternoon's event, and encourage them to go on to talk about it as well. Let's build a never-ending conversation and dialogue around HIV, because I think that's the only way we can think about ending HIV stigma in our lifetimes, and maybe even ending HIV in our own lifetimes. So once again, thank you very much. Stay safe, stay healthy, and we will maybe see you again next year for World AIDS Day 2021. Thanks so much.